Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Hi, everyone, and welcome back to this week's episode of the Tongue Tie Experts podcast. This is Lisa Palladino. We've taken a couple of weeks off, but we're so excited to be back with our new shows. I hope you enjoy them as much as I enjoy recording them. Today, we have a special guest. We have Dr. Jessica Leighton from Naperville, Illinois. And Dr. Jessica Leighton is a chiropractor. She's actually defines herself as a pediatric chiropractor, and we'll talk about that today, and the mother of 2 children who had lip and tongue ties. So Dr. Leighton knows firsthand how troubling they can be to new parents and infants. In working with local IBCLCs and birth providers, SLPs, and pediatric dentists, Dr. Leighton strives to help families manage and correct the effect that oral ties have on them and their babies, as well as educating other professionals regarding proper assessment and management options. Dr. Leighton is an active member of many professional organizations, and I will list them in the show notes. She has completed lots of coursework and training specific to TOTs, and we'll talk about my favorite one, and oral motor dysfunction with various providers and organizations, including providers in her area. And she strives to stay up to date on the most recent techniques and research. Dr. Leighton, thank you so much for joining us. And I'm excited to chat with you today. One of the reasons is because when I asked you what you wanted to talk about, it was a topic near and dear to my heart, and that's the safety of chiropractic, right? So why is it? Can you tell us a little bit about why is it that we are so, quote unquote, afraid of chiropractic, especially for children in this country?
So I think part of the issue that in regards to safety for kids that are getting adjusted by a chiropractor is that we see so much stuff on social media and the internet with adults. And so as an adult, we're taking our child to see this bodywork provider that we know nothing about, or our only experience with chiropractic care has been for an adult or for themselves. And, it can look aggressive. It can look like it's really forceful. And oftentimes those videos on social media, there's extra microphones and that involved to make it sound, super
Mhm.
crunchy and, for the
Mhm.
effect of, a social media post. But in
Right.
reality, that's not always what it's like for even an adult to be adjusted.
Right.
And for a child, it's only about 5% of the force that we would use for an adult that we would use
Mhm.
on a child or an infant. There's no popping, twisting, cracking. It's not like
Mhm.
that.
That could be the
But a lot of
headline.
people,
There's no
yeah,
cracking, right?
right, yeah. I mean, I occasionally will hear like a little pop, here or click here and there with a kiddo. It's usually, toddlers and that older kids. Um, but it's not as aggressive as you might think that an adjustment
Right.
would be for an
So
adult.
what because in my practice as a lactation consultant, I often refer families to the chiropractor for
Yeah.
different reasons and for their babies. And sometimes they come back and say it almost didn't even seem like she did anything,
Right.
but
Well, that's
but it
important because
helped.
it's
But it
gentle.
helped, you know.
Yeah, with the adjustments themselves, for an example, to adjust a cervical spine for an infant,
Mhm.
I usually have them lying on their back on like a pillow or mom's lap, and I just use gentle, sustained contact with the tips of my fingers. The babies really kind of guide the movement that they're lacking and what they need, and so
Mhm.
I just put my fingers where I feel like there's a little bit of restriction and movement, and oftentimes they feel that too, and they'll kind of wiggle around a little bit, and almost kind of self-adjust in a way. I'm just using my
Mhm.
hands and fingers to kind of guide that movement, not forcing the movement, just allowing them to achieve the movement on their own.
Mhm.
And so, yeah, oftentimes parents will say like, "Oh, you already did it. You're done." And I'm like, "Yeah."
Mhm. Mhm.
Maybe fell asleep,
And
and then
and
just
yeah, I'm
keep
gonna
going.
ask maybe a silly question because this is often something that happens and, that I get reports back about, and I've had the experience with babies in my care and even my own grandson. They poop afterwards,
Oh yeah.
right? It's like the total relaxation for a child to be in that total Vegas let go, right? And
A
they
lot of them, they don't even hit the parking lot
right,
before.
right.
I
Yeah.
actually keep a whole big basket full of new onesies and wipes and diapers here just because we've had, the new parent that swapped out diaper bags and didn't have an outfit ready and
Right, right,
we're
right.
prepared. So, yes, very common for that to happen.
So, I believe because I was raised with chiropractic and I'm very
Uh-huh.
comfortable with it,
Sure.
I believe that everyone should be seeing a chiropractor regularly for maintenance, and then, like, I call it tune-ups when I need it, and I believe that, but that's not a widely held. I mean, it's widely held belief, but not universally held. Let's put it that
Sure.
way.
Yep.
So, I think that every baby should have a chiropractic adjustment, but what specifically about babies that have lip or tongue tie? And we're going to use the abbreviation for those who don't know the abbreviation TOTs. That refers to tethered oral tissues, and that includes lip tie, tongue tie, buccal ties if they are there. So if a baby has TOTs, why is that a specific need, and how does that, help that individual baby?
Sure. So, with especially with like buccal ties and that, um, anytime that there's an abnormality in tension of tissue in the body, it can cause asymmetry elsewhere in the body too. So,
Mhm.
the biggest thing that I talk to parents about is that yes, your child, this issue has been found and evaluated in their mouth, tongue tie, lip tie, buccal tie, but it has a bigger impact. It's not only affecting their mouth. So I'll show them anatomically how that same fascia that's around the tongue attaches. It's the same fascia that's near the diaphragm, the pelvic floor, all the way down to the feet. And so I show them how these things are connected. And I'll even sometimes, some of these babies are really good demonstrators. And so I'll say,
Mhm.
watch how when I try to extend their neck, they pull their hips up. They're
Mhm.
compensating and trying to alleviate this tension because there's something kind of stuck. And
Right.
so chiropractic care is really helpful because we can kind of alleviate any tension that's due to the tie.
Mm-hmm.
Obviously, we're not going to be getting rid of it, but if there's enough tension that it's causing, in a buckle tie, for instance, and there's, a lot of tension in this left side of the face and it's causing a little bit of a pull to that left side, now they might not have full cervical rotation to the right. They might not have
Mm-hmm.
full cervical lateral flexion to the right. And so it creates an imbalance in their movement and other muscle structures and other joints that can be impacted. And so I do full spine care on those kiddos. Oftentimes, it's pretty common for them to have their cervical spine adjusted by chiropractors when there's a breastfeeding or a latching issue. But
Mm-hmm.
I do full spine. The jaw and the pelvis are embryologically connected,
Right, right.
physiologically connected. So with their the embryologic development,
Mm-hmm.
and so then they just grow from there. And there's
Right.
fascial chains that are connecting. Even in, I'm an acupuncturist as well, and so even in
Okay.
Chinese medicine, there's connections between the
Right.
jaw and the pelvis.
And that
Um,
makes so much
as a
sense.
midwife, you probably make sense out of that too. With
Yes.
we want women to
Yes.
keep their
In
mouth
birth.
nice and
Yes.
relaxed, and then their pelvis is nice and relaxed
Mm-hmm.
right for birth.
Yeah.
So,
So as a midwife, you often say, relax your jaw, relax your jaw, So I'm finding this interesting and connecting it to those babies when I place them on the scale and
uh-huh,
I put their back flat on the scale and their feet go up,
uh-huh,
sometimes to one side, not the
yep,
other. And
yep,
in my own, you know, I've gotten a lot of body work terms over the years because I've
yeah,
been doing this for a long time. But I try to explain it to parents like babies are born mostly all curled up,
yeah,
right? And it's like some babies uncurl easier than others.
uh-huh,
Does that make like, is that a way, like, am I saying the
yeah,
right thing? Like some
sure,
babies need help in curling out uncurling evenly. And it's very simplistic, but I think that helps. I've seen light bulbs go on in parents when I explain it
yeah,
that way, that we're not going to do anything to the baby except assist them. And like you were talking before, that the baby guides your adjustment. We're just helping them to get to their best potential of movement and relaxation in their
for
body.
sure. Yeah.
Yeah,
And that's the thing with I try to stress to parents that we're never forcing anything with a baby or an
right.
toddler. Um, I do a lot of walking adjustments here in the office. The kiddos that are mobile, crawling and walking and toddling around. We get them playing and we adjust them and we do what we can. There's
Mhm,
days where I've had a new patient come in, an infant that has suspected lip or tongue tie, and they're not having it. Like that day, they are just not in a good place. There's a
mhm,
missed nap or someone's hungry. And so we try to give lots of time so babies, they can have that diaper change and get fed before we do an assessment. So
mhm.
they're not, hangry while we're trying to
Right,
do an oral
right,
assessment.
right,
But there's been a couple parents where I just said, you know what, I don't think today's the day that we're going to do much.
right.
Baby's not in a good spot. Sometimes they're just like these high stress, tense babies,
Mhm,
and a stranger, I'm a stranger to them. They don't know me.
mhm.
My office is a new, strange place. And so, there's days where I'm like, you know what, maybe today's not the day. And we just kind of
Right.
do what we can with those kiddos that
Mhm,
day. And we do more later. But
mhm,
yeah, so babies and their birth can play a large role in that too. So, part of my
mhm.
history is oftentimes, what was mom's like kind of birth story? How was her labor? Or was it a really fast, precipitous labor? Or was it really long and prolonged? Was
Mhm.
baby
What
kind of
position the
jammed right in?
baby was in,
Oh,
right? I
yeah,
mean, that
the
could.
posterior. I mean, that plays a
Yeah,
huge role. We've
yeah.
seen babies in posterior position, and that puts a lot of normal anterior position is great because it kind of splits their cervical spine. It's a nice protective position. But when they're posterior, I mean, there's so much pressure coming and pushing their head back into extreme extension.
Mhm,
And that can cause irritation to the joints, the muscles, the nerves, everything can be kind of overstretched and
mhm.
irritated. And even, for an adult, if we overstretched a muscle, I tried doing a cartwheel with my daughter the other day, overstretched some things, wasn't feeling my
Oh my
best.
goodness, I did that this summer too, and it was so silly. It was the
Yeah,
dumbest thing.
painful,
I was like, "Oh, that wasn't a good idea."
but,
So
we know what it
yeah,
feels like to have something overstretched or kinda
yes.
strained, and that hurts, it's
Mhm,
uncomfortable, it impacts our function.
mhm,
For a baby, their main function is just being able to adequately, be fed.
Right.
Um, but it can be impacted by, the birth process. That's a lot of
Of
trauma
course.
and stress on their little bodies. And so that's a
Mhm.
big part of my history taking, is, how long were you in labor? How long was your pushing stage? What was baby's position? Babies that are multiples, with twins, usually there's one baby
Mhm.
that's a kind of an ideal position and the other one's just figuring it out and taking up what
Mhm.
space they can around, twin A.
Mhm.
But it
You know
all plays a
what?
role in their
Yeah,
their
I like that you brought that up because I had twins recently in my office for breastfeeding help, and one of them had to go to NICU, and
Okay.
I wasn't really taking that full picture of it wasn't just the NICU experience that had affected the baby. It was probably because the reason the baby had to go to NICU because he was
Yeah.
in a probably awkward position and was the second baby born, and
Yeah.
that might have been a part of it. And I don't always consider that with the twins. That's a
Yeah,
great
even
way to
like
look
their
at it.
positioning, their cranial molding. I mean, I've seen
Yes.
twins come out and like one has kind of a flat spot already. They're newborns. They're
Mhm.
not. It's not like a plagiocephaly from lying, on their back all the time or something
Mhm.
like torticollis. But they might have been jammed up against, the other baby or
Right.
part of mom's, bony pelvis or her rib
Right.
cage or something. And
Right.
so it's important to know all that because if they're in that position for weeks or months, and we have this tension that's developing in one side of, there's an
Mhm.
asymmetry in their development,
Right.
yeah, that might cause some issues with nursing or
Yeah.
bottle feeding afterwards.
If you are a professional who's interested in knowing more about tongue ties and breastfeeding, I'd like to take a moment to invite you to learn with me. If you're listening to this podcast in September of 2022, you are just in time to join us for the free webinar, 5 Facts About Tongue Tie That Breastfeeding Babies Want You to Know. It's totally free, just for professionals, and that means any professionals, IBCLCs, CLCs, other lactation providers, doctors, dentists, midwives, nurses, OTs, PTs, SLPs, chiropractors. I hope I'm not forgetting anyone. All professionals who work with families pregnant, breastfeeding, planning on being pregnant or breastfeeding, any of you who work with families are invited. Join us on October 4th, 2022 at 7 p.m. Eastern Time as I shatter some myths that you may have been taught about breastfeeding babies with tongue tie. The link is in the show notes, but it's a bit.ly link, bit.ly/5 tongue tie facts with the first letter to each word in capitals. So there's a capital T, another capital T, and a capital F. Sign up today because it's happening soon. 5 facts about tongue tie that breastfeeding babies want you to know. There'll be lots of time to have your questions answered during the webinar. And if you are considering it, you'll hear about an opportunity to join our professional course. While we are live, I'll announce an opportunity for a deep discount on the Professional's Guide to Tongue Tie in the Breastfeeding Infant. And the whole webinar is going to be recorded, but if you're there live, you'll be eligible for a special bonus that's only for those who are listening live. I sure hope you'll be there. Again, all the info is in the show notes, but you can follow the link to bit.ly/5 tongue tie facts. See you October 4th. So, you mentioned in your bio, or I mentioned when I read your bio, about that you work with a team. I mean, you
Yeah,
didn't say the word team, but to me,
yeah,
that's a team, right?
absolutely. Yep.
You work closely with the CNM. I know you share an office with a midwife, and there's IBCLCs and dental providers for release,
Uh-huh.
right?
Yep.
So, where do you fit in on the team as far as, your ideal situation with a mother baby dyad? Like, when would they see you? I'm talking about a mother baby dyad that's having struggles with breastfeeding and the IBCLC knows it's related to tongue tie. So where do you fit in there?
Yeah. So most of the babies that I see here are either referred from an IBC. There's a couple IBCLCs locally that I work with closely. They're either referred from them because maybe they were, born in the hospital, and that IBCLC recommended someone else for them to see, once they went home. Because I see as a chiropractor so many pregnant women as well. About half my
Mm-hmm.
patients are infants, the other half are pregnant women. I try to educate moms while they're still pregnant. I ask, like, what are your plans for feeding baby? Are you planning on breastfeeding? And I really encourage them to do a prenatal consult or visit with an IBCLC so that
Do you
everything's
see me like standing up and
right.
cheering?
Yeah.
Yay!
Um,
That's
because
my
there's some
ideal plan too.
It's great, and it really works out well.
Yes.
IBCLCs in our area are so phenomenal, but once you have a problem, it could be 2 or 3 weeks before they can get you in.
Right.
And so,
Right.
if they have that prenatal consult, they can get they're already established
Right.
with under their care. They can get in
Right.
faster. So those moms, because they know how much I value, the IBCLC's training and their support, but they also know that I work with some of those issues too. So sometimes
Mm-hmm.
they're seeing me first because we already have this relationship. I saw them, days before baby was born, and they come back in with baby. They're
Beautiful.
having some issues, and I'll do an assessment and see what's going on. And I'll say, I really do think, you need more support than what you got in the hospital.
Mm-hmm.
Here's, some
Right.
lactation
So the
support.
referrals go in all
They
directions,
go in
which
all
is
directions. Yeah.
beautiful.
I mean, I work with a
Yeah.
midwife, and so I'm just this morning, I was at a birth. I did
Mm-hmm.
adjusted mom in labor, but then also did a quick assessment on baby afterwards as they were
Mm-hmm.
trying to get him to latch for the first time.
Mm-hmm.
We kind of suspected some issues there because he's baby number 3, and both of his sisters had ties as well, and mom
Right.
has ties, dad has
So she's
ties. So
prepared.
we kind of knew what was
Yeah.
going on, but yeah, I did an assessment then. So yeah, the referrals are going both ways. But there's definitely times where I don't think that I'm like the best option for a baby. Sometimes babies need more than, a couple of adjustments. I've referred babies to SLPs, if there's
Mm-hmm.
truly more of an oral motor
Right.
issue
Right.
versus neurologic, I'll send them there. I
Mm-hmm.
co-manage with them a lot.
Mm-hmm.
And so
Same.
we try to like make sure it's also not overwhelming for the parent too, right?
Right.
Because then it's like, okay, you need to see, your 1 week, 2 week, 4 week visit for baby, and then you have to have your 6 week visit for mom, and then here's the
Right.
chemo visits and lactation visits. And so I try to kind of get all the care that we need from all the different professionals, but balance it so that they're not going to 3 and 4 visits a week and just
Yeah.
feeling overwhelmed with
Yeah.
appointments.
That could be so challenging. And I think that's another universal um, effect that we see on the postpartum family that
Yeah.
wants to do the best for their family and they
Right.
want to reach their breastfeeding goals, but they're trying to recover and they're trying to learn to be a parent and
Yeah.
we're telling
Or
them
have
to rest
other
and then every
people.
day there's somewhere else to go and sometimes
Oh
there's
yeah.
a long drive.
Right.
I just want to back up to what you said about the prenatal consult, and that also plays into how difficult the postpartum period can be for
Yeah.
especially first time moms.
Yeah.
And what happens if you need a lactation consultant or you suspect you need a lactation consultant because you're having some concerns, whether it be nipple pain or baby's not latching or you're concerned about your supply. If you haven't already made a relationship, it's very
Mhm.
difficult even to pick up the phone.
Yeah.
It's over what you're overwhelmed at that point, and there's so much to deal with.
Yeah.
And over the years, I've learned, a bit of more patience for parents who will reach out to me, and then I'll answer them back right away, and I don't hear from them for 2 weeks because they
Yeah.
can't wrap their heads around what to do. And I don't blame them. It's just
Right.
I've been a new mom myself. I know.
Yeah.
So having that relationship ahead of time, it's like calling your friend and saying, "Yes, the baby's out now and now I need you."
Right.
And
Yeah.
it's just so much easier to have that relationship, to have talked ahead of time about what to expect and when it's important to reach out. So I've been
Yeah.
doing more and more of those package deals where there's, it includes the prenatal visit and
Okay.
and
Nice.
like I like to see them within the first week. And I've had parents come to me straight from the hospital,
Yep.
right
Yeah.
here instead of going home because then they don't
Yeah.
have to go out again.
Sure.
I wish they didn't need me that desperately, but
Right.
unfortunately.
Oh, yeah. Yeah.
Unfortunately, where in my location there's a lack of there's a lack of individual lactation care in the hospital. Let's put it that way.
Okay. Sure.
The lactation consultants are doing the best they can, but
Sure.
there's just too many babies and not enough of them.
Yeah.
So, and it's very, hats off to all the lactation consultants listening who do still work at the hospital. I've been there. I feel your pain. I'm not
Yeah.
saying there's anything wrong with you.
Oh,
It's
no,
just
not at all.
hard. It's just hard,
Yeah. It's not that
and it's a
individualized
different
care
kind
that
of
they need.
care. It's a different kind of care that you have to give when you're there.
Yeah.
Um,
Yeah. We got lactation consultants out our way that, we're fortunate that we have some that will do home visits and they can go and
mhm.
sit with their family for 1 or 2 or even 3 hours and try to
Yes.
troubleshoot and get things going. And so there's times where, they'll say, oh, I met with a lactation consultant at the hospital and they said everything was fine. Or we got to point, from point A to B, but we're still trying to, get somewhere else.
Mhm.
And they say, oh, well, I already saw lactation. Do I really need to see someone else? I'm like, well,
Mhm.
like you said, they're in the hospital. You're not their only person they're working with right then.
Right.
They're overwhelmed. Oftentimes, at least in the hospitals by us, the lactation consultant is not functioning just as a lactation consultant in the
Exactly.
hospital too. They're L&D nurses, and so they don't have the time to sit with you necessarily. And no fault to them, but they don't have the time to do that
Right.
and give them the
Right.
support they need. So we like
Yeah.
those prenatal visits just to make sure that they're established with somebody, that they're not doing research at, 4 days postpartum with terrible nipple pain and,
Right.
being up at 3 a.m. feeding a
So,
baby.
Dr. Leighton, do you then see the babies who need release after release?
Yeah, I see them before and after.
Before and
So
after, okay.
I like to see them at least, in an ideal world, I would see them a few times prior to a release.
Mhm.
That way we can alleviate any joint imbalance, muscular tension that is not related to the tie.
Mhm.
That way, when they go in for that tie assessment, the docs nearby that we like to refer to do their assessment and the release all in one visit,
Right.
if the parents are up for that. And so it's nice because then when they do their assessment, the tension that they're feeling, they know is related to the tie and
Right.
likely nothing else. And that
Right.
way, when they do their post release assessment and they feel all that muscular tension and fascial tension, they know whether they were able to get a full, nice complete
Release.
release of the
Yeah.
tie. And then I will see them again, afterwards, of course. And I almost work more elsewhere in the body afterwards. So we're
Mhm.
working at, releasing some hip tension that was present that, those babies that are just like curled up and they look like little frogs.
Mhm.
We're
And
working on
everything's connected,
that
right?
instead. Right.
Sometimes, right, like when something's released, the tension may move somewhere else and you have to release
Yeah.
that
And
tension.
so we need to kind of help the body
Yeah.
rebalance itself and get
Right.
that symmetry back. Plus, then there's a neurologic component to chiropractic here too. So, the adjustments themselves, yes, mechanically are helping improve movement in the joints and the muscles, but every time we do an adjustment, it's also a big amount of input to the nervous system. And so
Mhm.
we can help with that, sympathetic response and that vagal tone to make sure that yeah, they can maybe move better. They have this mobility, but can they calmly rest at the breast and calmly
Mhm.
nurse? Or are
Mhm.
they kind of in this fight or flight tense
Mhm.
situation?
Yeah.
The mobility and the anatomy is one thing, but we also need them to neurologically be able to settle and,
Right.
calmly nurse. And, part of that, they just need to know that they're safe, right? So,
Right. Yeah. And
um,
even not only just with feeding, I mean, there are some babies that I know aren't even able to maintain tummy time because of their
right.
tone and
Yeah.
their, and so calming that down. And also, we're talking about mainly today about breastfeeding, but this is also for bottle feeding because
Oh, absolutely.
there are attention
Yep.
patterns that affect bottle feeding as
Yep.
well, right?
For sure.
Right. So that's great. So
Yeah.
I'm happy to say that if we lived in the same neighborhood, I would love to collaborate with you because
Oh,
we're
same.
definitely on the same
Totally.
mindset. And part of that might be because of you're a graduate of my course, right? So you
I
took
am. Yep.
I was so happy that you were a part of Professional's Guide to Tongue Tie. And I hope that that was helpful to you to understand I try to especially help other kinds of providers understand the breastfeeding point of view
Oh,
in that
absolutely.
course.
Yeah, and I work with your course was really great because I had a lot of experience with ties even prior to taking the course, but it's nice to see how other providers it's to get that information from a midwife and an
Mhm.
IBCLC. I've taken loads of coursework as a chiropractor from other chiropractors, but it's really nice to see how other provider types are managing these same patients so that we can better kind of streamline their care both before and after the releases are
Mhm.
done, or if a release isn't done, ways that we can still help, kind of coordinate care. That way we're all kind of on the same page. And so, you focused a lot in your course on this team approach to the lip and
Yes.
tongue tie, care. And I think that's where in some places we're kind of lacking. And so I was glad to have had that with your course. It really kind of, I don't know if stabilize is the right word, but
Yeah.
help me coordinate my care better versus just
Right.
being like, I'm the chiropractor, I'm doing this stuff, you're the IBCLC doing this stuff, the SLP is doing this thing.
Right.
So it was really nice to kind of not only co-manage, but also understand what other providers are doing. So
Right.
I've done a
That's
lot of work with that.
perfect. Thank you. Thank you for saying that because that's my goal. Like you just
Yeah,
verbalized and put into words the goal of my course. And one of the problems with the way we all learn is that we do learn in silos. And this happens in all, in medical education as well.
sure.
Doctors learn with doctors and nurses learn with nurses, and
Right.
midwives learn with midwives, and lactation consultants learn
Yeah.
with lactation consultants. And it wasn't until I went to my first, it was the IATP back then, the first
Okay.
international conference
Hmm.
that I went to, and I walked into the room and I saw all different professionals learning together and speaking
Yeah.
to each other and having respect for each other. It didn't
Right.
matter what your title was, everybody was respected at the same
Yeah.
level. And that continues. We're both members of ICAP. I just came from the
Yep.
conference. I'm all on fire from that conference. It was amazing.
Yeah.
So ICAP, IATP, all interdisciplinary learning.
Hmm.
That's so important
Yeah.
in this work that we do because we're not a part. We're a whole. We try to
Yeah.
break this body that we have into parts, and that doesn't work. And we all before I started working with tongue tie, I had no idea, like, say, what an occupational therapist was. I had no idea. I hadn't
Sure.
even met one except, maybe a quick meeting at the bedside when I was a nurse with someone coming to help a patient learn to feed themselves or something.
Right, or like OT for my husband has said this. We were at a wedding months ago,
Mhm.
but I introduced him to some friends of mine, and his wife is a pediatric OT.
Mhm.
And so my husband said, "You're an occupational therapist for babies and kids?" And he goes, "Well, yeah." And he goes, "Well, what's their job? Just to play?" And she goes, "Exactly." And he goes, "Oh,
Yeah. So there's so many ways that we need to understand our roles in order to be able to know who to refer to. Because there's sometimes that I feel that a baby needs a chiropractor, and there's sometimes that I know that they need the OT before the chiropractor, or vice versa, or you
yeah,
know, and different families feel different comfort levels with different types of providers. And then there's always like the financial aspect of it and things like that.
yeah."
So, yeah, so that's great. So, the other thing that I wanted to ask you is the term pediatric chiropractor.
Hmm.
Is that a special degree, or is that just something that happens when you specialize and take courses to get better at those types of
So
cases?
it's not a separate degree. I'm assuming you're meaning more like a pediatrician has like a
Right,
board
right,
certification. They're an
right.
MD.
There's
Yeah.
not a
So
pediatric chiropractor school separate from an
no.
adult
And
chiropractor.
in fact, it's really troubling
Mhm.
because as a chiropractor, and this is, I know this to be true for my particular school that I went to for chiropractic school and working with other colleagues from other chiropractic universities. The education in chiropractic school as a general chiropractor, once we graduate, really doesn't include anything for pediatrics or pregnancy.
Wow.
It's discussed in that they say, yeah, you can adjust a baby or you can adjust a child, just be really careful.
Wow.
Or you can adjust a pregnant woman, just be careful and don't put too much pressure on her abdomen.
Mm-hmm.
But like that is not sufficient education. So
Right.
if you're going to seek out a chiropractor, a pediatric chiropractor to be part of your referral network or your referral team, there's a couple things that you can look for to know that they do have adequate training. So there is the American Chiropractic Association has a pediatrics council. And so they offer additional coursework, but this is all beyond your chiropractic degree. So it's
Right.
all continuing education on childhood, ailments and illnesses and the techniques on how to adjust a child versus an infant versus an adult. Some parts of adjustments look very similar, but we're using, a fingertip instead of a whole like palm of my hand contact. It's usually smaller force, smaller area of contact. And so the ACA has a council for pediatric chiropractors. The ICPA offers a lot of coursework for chiropractors to become more efficient in safely treating children and infants. We also, as a midwife, you're probably familiar with Webster technique. I'm sure you've probably heard of that.
Absolutely.
And that's a certification through the ICPA as well. But that even kind of gets messy with, these certifications that we have because the ICPA offers this Webster technique certification, but that's for pregnant women.
Right.
It has nothing to do with infants and children. And so I will, I'll be talking to parents or, outside of the office and I'll say, have you considered taking your child to see a chiropractor? Do you need help finding someone that's, efficient working with babies? I'm like, oh yeah, I saw a chiropractor when I was pregnant. They're Webster certified. I'll take them there. I'm like, well, that's
They're
great.
thinking, they're assuming if they're Webster certified, they know how to
Right.
take care
And
of
so
them.
there's this assumption that they're synonymous, and they're not.
Right.
Now there are lots of chiropractors that are pediatric chiropractors and also Webster trained,
Yes.
right? So that's
Right.
great.
The one that I refer to, I'm very
Right.
pleased.
Yeah. So
Yeah.
it's oftentimes that they are both, but it's
Mhm.
not something that you can just bank on. So, I gave a talk a couple weeks ago for other, mostly SLPs on body work for kiddos and how to find the right fit to refer to. And so, I go in and I will say, how often are you treating babies? If it's a chiropractor that treats anyone and everyone, there's no problem with that. But if they're treating, an infant once a week or, every couple of weeks, like that might not be the person that you want to take them to.
Right.
They might be perfect, be doing a good job. But someone that treats babies regularly, I mean, that's half of the kiddos I see in my office. Sometimes I see more infants under the age of 1 than I do adults. But we want to make sure that they've done sufficient coursework in technique and all the different issues that go along.
Is there any place to look up that, or you would just ask?
So the ICPA website, it's icpa.com, I think, or it might be .org. It's ICPA for kids, the number 4. They have a directory, and you can go in there and look up your zip code, area code, and find chiropractors in your area that are Webster trained or with other credentials that will show that they've done further training for pediatrics. And then the ACA Council on Pediatrics also has a provider directory of providers, and those are nationwide.
And these will all be in the show notes for those listening who are maybe in the car and trying to remember these initials. I'll put them all in the show notes so that people can just click through. So
and if you're looking for someone to refer, ask them, where did you do your training? What kind of training do you do? I know pediatric chiropractors that don't do anything with feeding issues or breastfeeding, and that's fine. They have a different specialty. Ask what is your specialty? How often are you seeing babies? Ask to shadow them in their office and see, how is their office set up? Are they conducive to supporting families if mom needs to breastfeed or something? Or change that blowout diaper after they got that sacral adjustment, what is their office like? Is it supportive of families coming in? And ask them.
Yeah, that's great information because one of the I don't know, very often I get the question from other providers like myself, IBCLCs or SLPs or other providers who are looking for networking teams. And they say, but how do I find somebody? And, your suggestions are perfect. And that shadowing is so important. I was fortunate enough I actually found my first office because the office across from my chiropractor was for rent. So
Oh, there
she's
you go.
like, "Why don't you go see the office?" And
Yeah.
it was a train wreck, and we had to do a lot of fixing. But it was wonderful because I could then come in with my patient and with the baby as she
Yeah.
did the adjustment, show her my assessment. She would tell me her assessment.
Yep.
It gave a lot of confidence to the parents because they could see how well we worked together and that we were on the same page, saying basically the same things from a different point of view. And I
Right.
learned a lot from my visits to her office, watching her with the babies. And I felt confident then to be able to tell parents, when you go to Dr. Jen, this is what's going to happen there. Because
Yeah.
because I experienced
You
it,
can do it.
and there's nothing like that. And, I wish more people would want to come to my office and see what I do, but nobody wants to spend the time that IBCLCs spend.
That's the tough part. Yeah.
Yeah. Yeah.
Or come to New York, I'd come visit.
Yeah.
Um, yeah, no,
Absolutely.
and I referred to a couple of pediatric dentists in our area that do the releases, and I've gone to their office, for days at a time to watch them do the
Hmm.
procedure. So similarly to what you said, you know what they're going to do. So when I have a parent or a family that's in and they're, really nervous about their upcoming release procedure, I can say, this is exactly what they're going to do.
Right.
You're going to
Right.
go in this room, and then they're going to do this with the baby, and X, Y, and Z. And so I know all of their staff names,
Right.
Sherry's going to help with this, so they know that I've witnessed what they do. They know that I trust this provider to do the
Right.
releases and their staff. He's doing my tongue tie release later this week.
Oh,
So,
wow. Good luck.
yeah,
Oh my
yeah,
goodness.
I have it on Friday, but it's nice to be able to know exactly what's happening there. Same with
Right.
the IBCLC that I refer to. She helped me with both of my kids, so I
Right.
know
So,
what her care is like. And so it's really great.
So here's the thing, Dr. Leighton. We were supposed to talk today about your experience with your own kids, but
Yeah,
now that you're saying that you're having your own release, I think
yeah,
we should have you back on maybe, in a couple of months, and we'll
sure,
talk about all that because I don't want to keep you all day.
sure,
And that's we could probably talk for a couple of hours on what your
yeah,
kids' experience was, right? And how that got you to this field. So we're definitely going to have you back.
yeah, perfect.
And I just want to say thank you so much for joining me. This conversation has confirmed some things for me and taught me some things, and I'm confident that our listeners will have learned some important tips about infant chiropractic, about how to find a chiropractor to either work with or refer to. So I
Sure.
really appreciate that. And for those who want to get more information, if you live near Dr. Leighton and you want to find her, all of her information will be in the show notes. Thank you so much for being with me today, and I hope
Cool.
you enjoy the rest of your afternoon.
Thanks for having me. It was good to be here. Thanks.
Okay, bye-bye. Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.